Assalamualaikum and good morning everyone. Salam sejahtera. My name is Adiba Kamarul Zaman from University Malaya, and I'm very pleased to moderate this third episode of COVID-19 Seeking Solutions, hosted by G25 and the EdUnity Foundation. For those of you who joined us last week, you'll recall that we had a really great conversation on seeking solutions for people in detention centers and prisons. This morning, we hope to have a similar great conversation with 4 speakers very well versed in the subject on how do we find a solution to arguably the biggest challenge in managing COVID-19 in Malaysia, which is infections amongst foreign workers. As of 3rd of February, from the Prime Minister's speech, Yang Amat Berhormat Perdana Menteri shared with us that of the more than 200,000 cases at the time, we're now approaching to 300,000 cases. 59% of infections arose from workplaces, 19% from detention centers and prisons, 14% from households, 5% from religious settings, and only 2% were imported cases. So as you can see, close to 2/3 of our current total cases arise from workplaces. And of those, more than 125 clusters were from manufacturing industries, more than 80 clusters from construction sites, and more than 60 clusters from the service sector. Most of you, or some of you, may also have read in the last 48 hours, 24, 48 hours, there were more than 1,000 cases, if I'm not mistaken, from a cluster known as Sri Gading in Negeri Sembilan, which is also related to a workplace. So there is no doubt, I think, we need to find solutions to this problem and bring the COVID pandemic to, not to an end, to a manageable level. It's fantastic that we now have the vaccine, and the rollout of the vaccine is now beginning. However, it is going to take some time, perhaps another year or so before we reach that magical 75%, 80% herd immunity. So the message is the vaccine is certainly something that we all should be very, very happy about, and the government's worked very hard to get them, but it is by no means going to be a magic bullet. It is also very pleasing that the government has agreed to include migrants, both documented and undocumented, in the vaccine program. Until such time that we have everybody vaccinated, all adults vaccinated, we will still need to be finding solutions to bring the current high rates of infections amongst the industries to as low and as manageable as possible. So I'm very pleased to welcome our 4 speakers with direct knowledge as well as direct involvement in working very hard to contain the pandemic amongst foreign workers, as well as the manufacturing and construction industries in general. It's not just the migrant workers who are involved. Certainly Malaysians working in those sectors are also affected. So first up, we will have Mr. Adrian Pereira, who's an alumni of the Royal Military College. He is the executive director and co-founder of an NGO called the North Southern Initiative, a human rights and social justice oriented organization. And Adrian and his team have been working with the marginalized communities, including migrant workers and refugees from the ASEAN region, and will have a lot to share in terms of the barriers and challenges faced by migrant workers in this era of the COVID pandemic. Next up will be Dr. Yap Wei An, who's a health systems and public health consultant. And Wei An has worked with international organizations, including WHO, World Bank, and also Harvard University. He's an alumni of Harvard University, and particularly in the areas of social protection, health systems, and financing. And Wei An is the architect of a program called POISE, protecting, he'll tell you what it means, but it is what it stands for rather, but it is a comprehensive program for manufacturers and construction sites to prevent the COVID infections in their workplaces. And you'll hear more about POISE from both Wei An and Farhan during this session. The third speaker will be Mr. M.K. Goh, who's the Group CEO and Executive Director of Carex Berhad, world's largest condom maker. And Mr. Goh has been overseeing the marketing and logistics of their international business and brand development, etc. And I know that MK has been trying very hard to, and in these challenging times, to ensure that COVID-19 is kept away from the factories of Carex Berhad, and it has been a challenging time, and I think MK will share with us his experience doing this at Carex Berhad, which I think is emblematic of the challenges faced by industries in trying to bring the pandemic under control within their individual factories and organizations. And finally, we have Dr. Farhan, who is a public health physician from the International Islamic University in Kuantan. He's also currently the director of the Selangor Task Force operations side to try and bring POISE and other measures that the Selangor Task Force has been active in into industries, and again to try and bring the pandemic under control in this particular area in Malaysia. So with that, I would like to invite Mr. Adrian Pereira to perhaps share with us the challenges faced by migrant workers during these difficult times. Adrian, over to you.
Yeah, good morning. Is my sound clear?
Yes.
Okay. So first of all, I have a disclaimer. I don't just represent North-South Initiative. I represent a few coalitions that work with other NGOs on migrant rights, and even more importantly, with the migrant leaders. The problem with the advocacy culture in Putrajaya is whenever we try to bring migrant leaders to talk with the various agencies involved, some of the officers will say no. Some of the higher ranking officers feel uncomfortable having migrants, but there are some in, for example, the Labour Department and even MAPO, who are a bit kind and give some space. But I cannot claim that I'm representing migrants, because that would be a big disservice to all the migrant leaders. And I hope in the next round of any public discourse, we can see migrant leaders on board. But the last time we did that, oh my goodness, the amount of hate speech and very harsh reactions from Malaysians were quite dramatic. And that has scared the migrant leaders into coming public. The second disclaimer is I'm sorry, I have to apologize to my colleagues in the civil society that if I knew that this was going to be a manel, I would have pulled out. I would have kind of found another colleague to stand in. I'm sorry, I think G25, please, there are other women experts who can speak on the topic. I just needed to know a bit in advance. So I'm going to get into the topic, and one of the big problems is we don't have enough data. There's certain firewalls between ministries that prevent us from getting sufficient data in order to make policy decisions. So me and my team scramble on the ground, interviewing migrant leaders, refugee leaders, but the data by the embassies, of course, they have their own data. And of course, the different ministries have their own data. And I'm sorry to say the data are not coherent, or they have different data sets which are not consistent. So I'm very worried, especially with the large number of irregular migrants. I take this opportunity to tell Malaysians to not use the term illegal migrants, because 90 to 95% of what we label as party are actually victims of forced labor, human trafficking, and smuggling. So unfortunately, in Malaysia, we still criminalize victims, whereas in other countries, they're given safe space to return or rejoin the labor force. I think my esteemed colleague here in the corporate world will know exactly what I'm talking about. So the honesty with data is not there. This is going to be problematic. The industries are also, not very honest, because you have a big number of undocumented workers contributing, but I'm not sure what are the security issues you face with regards to your legalization process or documentation process. So that is going to be very challenging. I'm not from the academic background, but I hope we can look into this and be a bit more transparent. My second point is the government, I don't know for what reason, has decided to weaponize foreign workers and the whole issue of migration. And I'll tell you a small story, very quick one. So I remember last year, a master's student from a prominent university came to see me. Adrian, my lecturer, asked me to talk to you about a very strange topic. Migrant workers are a security threat in ASEAN. And I got shocked. And I asked her politely, I said, where did you get this topic from? Oh, my lecturer gave it to me and it's going to be my thesis. And I said, did you ask your lecturer why, what is the basis of such a topic? And I'm sorry, a master student couldn't answer me. She said, my lecturer gave me, I'm here to talk. The lecturer said, come and I get from Aiden. And I said, no, go back to your lecturer and say migrant workers are not a security threat to ASEAN. But then that kick-started a bit of my investigations. And I think it is a government policy to look at migrants, migration in a security framework. Now, it's a bit problematic. I can understand if you say border control is a security issue. But here you are, depending on 2 to 4 million. I mean, it's a crazy debate to discuss how many migrants we actually have. But you know the industries are benefiting from the hard-earned income, the hard work, sweat, and blood of migrants. My cases I handle have shown migrants work 12 to 16 hours a day. But you look at it from a security angle. So my two theories are like this. One is a bit conspiracy theory, and it's a bit crazy. There is a deep state operating which wants to maximize the profits from these migrants. And I will substantiate my claim by saying the Parliamentary Accounts Committee report released last year and shows hints of the abuse in the SOPs of recruiting migrant workers. Now, I also work with Malaysian workers. Malaysian friends have hammered me on why I keep defending migrant work. I said, no, it is a labor issue. So in the defense of labor, we have to look how Malaysians are going to get jobs and migrants. But as you can see, there are ongoing negotiations to bring migrant workers in. And of course, if we feel that we can maximize profits from labor migration, then it's going to continue. But the problem here is forced labor and the securitization of migrants. So when you securitize, we have seen some of the impact, and I'm afraid this is going to prevent the migrants from coming forward to get the vaccine. So I did a bit of homework last week, and I called some of the migrant leaders, and of course, the more literate leaders, the migrant leaders who are a bit more literate and have secure documentation have no problem. They said, yeah, we're gonna accept the vaccine, but the undocumented workers very clearly said, no way, no chance in hell, we're not coming out. When Raihan Kabir came on Al Jazeera to share a bit on what he observed, we criminalized him, and of course there was a misunderstanding in that video of how the health versus security issues is managed, but we still today we criminalize the migrant workers, and this is highly problematic. A few days ago, the boat, despite having a court order, our immigration officials decided to deport a whole batch of migrants. So this is going to be problematic, and to be honest, I don't have solutions for that, proposals, except de-weaponizing this whole migration permit, and of course, coming up with a moratorium for the whole period of vaccination for migrants. De-enforcement activities have to stop. And also, I think it's vital for the public to know that the enforcements that are going on have not been done in a fair manner. There's no investigations to how the migrants get undocumented. They are criminalized. They don't get that one phone call to the lawyer or to their family or to the embassy. This is problematic. So how are they going to come forward? I think this is a serious question we need to ask. And while embassies may be that buffer or that safe zone to facilitate the vaccination of irregular migrants, we need to work out a few more details, because the embassies can also be a bit problematic in terms of corruption allegations. Getting into the queue itself can be problematic. So it's time to bring all these factors together under a comprehensive policy for labor migration in the long term. But for vaccination, it has to be comprehensive. And please start by bringing the migrant leaders on board. They will explain to you the cultural communication competencies that are missing in our health system. And unfortunately, in the Malaysian health system, we have decided, for God knows what reason, to remove the subsidies. And when the minister, I think it was 2015, when he decided to do that, it was based on very wrong data. Migrants are not paying their bills. So I would like to put it on record. Migrant workers have been paying taxations, even undocumented workers through GST and SST. So those funds are huge. We have an estimate of, while they were paying the levies, it would be up to 20% of a worker's salary, of course, including the recruitment fees and so on and so forth. That money is in the government treasury and supposed to be for services to migrants. I don't know what services the Malaysian government is providing to migrants. And I even gone to say that migrants are subsidizing us. This so-called free vaccination is already been paid by the migrants. This is not a free thing. So let's make sure it's rolled out properly. Look at the finances, make sure that the allocations are transparent, and the cultural competencies are very clear in rolling out. Some migrants are saying we don't even understand the issue. What is this COVID? What is vaccines for? Why do I need to get something which has not been explained to me clearly? And I think this is a vital ethical point in rolling out vaccines. The communities need to know what they're going to inject into their bodies. So these are some of the challenges. I think my esteemed colleagues here will explain a bit more. Once again, I will propose that we have a more comprehensive policy on labor migration. Health and the vaccine rolling out is a good starting point, but we need to decriminalize irregular migration. And hopefully we won't see the academic world churning out more theses, strange theses like, oh, migrants are a security threat to employers, to ASEAN. They're not. Please don't do the dirty work of the deep state. It's really not helping. On the ground, our hands are full, and we want the migrant leaders to come on board. But they will not come on board as long as this issue is securitized. So I think I'll stop here for now. Later on, if there's additional points, I will continue. Thanks.
Thank you very much, Adrian, for putting the challenges of handling migrant workers, particularly in the context of vaccine rollout, so clearly. Next up, and I'm sure there'll be questions coming through, Slido, following your presentation. Next up, we have Dr. Yap Wei On, who will speak on the public health issues around migrant workers and COVID-19. Wei On.
Thank you so much. Good morning, and thank you again for the invitation. I would like to discuss a public health approach to COVID-19 and foreign workers in Malaysia, and I plan to do so in 3 parts. The first part is, why should we consider a public health approach? The next part is, what would a public health approach entail in terms of broad principles? And the third part is, how can we apply it in practice? And with this, I'll bring up the example that Prof. Adiba mentioned on poise. Let me start with a summary. I think it's always useful to have that. We should adopt the public health approach, not only because it's ethically consistent with our values as a nation, but also out of just simple, pure, basic self-interest. What are the principles? A public health approach does not see the world in narrow silos, but sees the big picture, and it takes the long view. And furthermore, like the coronavirus itself, which infects and kills regardless of race, religion, or nationality, a public health approach also does not look at a person's passport or any visa stamps. It is not about I, us, or them, but it's about all. We're all in the same boat. And with that, let me start off the first section, which is why. What's the rationale for a public health approach? Well, whether it's the Prophet's hijrah from Mecca to Medina, which will be almost exactly 14 centuries ago next year, or whether it's the exodus of the Abrahamic peoples as indentured foreign workers in Egypt through the Red Sea, or whether it's Prince Siddhartha Gautama's foresights when he left the palace in Lumbini as a prince and decided to see what the outside world looks like, the narratives of many of our faith traditions in our country involve an early and powerful experience of migration or displacement, the experience of being foreign, leaving our comfort zones, and to some extent being at the mercy of natives. The fourth picture, foreigners have also made an important influence on our nation. So for example, we have here a painting of Arab traders, essentially foreign workers, praying on arrival to Malacca and subsequently introducing Islam to our nation. The inability to see them in us is a value which is alien to us. Let me just say that again. The inability to see them in us is a value which is alien to us. The world is in alignment with our values as a country, and collectively as a global community, the world gathered after the ashes of World War II and put into writing our shared values for health in the form of the 1946 Constitution of the World Health Organization. The Constitution, of which I've just taken one phrase of it, states not only our aspirations for the highest attainable standard of health, but states that this is for every human being without distinction of race, religion, political belief, economic or social condition. It is, if you like, basically a posh version of Kita Jaga Kita. But there is also another reason why we should adopt a public health approach. It is called self-interest. Even if we do not care about others, even if we want to disregard our values and our collective faith heritage, our explicit international commitments, a public health approach makes sense simply because it is in our own individualistic, primal, basic self-interest. And let me just share a few exhibits. Firstly, COVID-19 cases and deaths. Officially, I know Adrian mentioned that there are data issues, but officially, non-citizens account for about 13% of our population. Yet, when it comes to confirmed cases, they are overweight by almost 3 times. Yes, you may argue they're just infecting each other. Who cares about that? But we know that non-citizens are widely dispersed among us. They serve us in our homes. They work in our offices, serve us in eateries, cook our meals, and work in factories. In other words, they're everywhere. We may not care that they're unwell. We may not care that they can't smell their food because they have anosmia. But our self-interest would be the risk they pose to us, transmitting the disease to us, burdening our healthcare and public health system, prolonging lockdowns, providing a population for new variants to develop, and affecting our livelihoods. But let me also show you the third chart, that even though non-citizens have a very high chance of infection, they are young and healthy, and hence they do not contribute disproportionately to deaths. Citizens, on the other hand, are actually overrepresented in terms of deaths, probably because we're older and have more comorbidities like obesity and diabetes. But it's important to remember, yes, it is ultimately us who die, not them so much, due to a failure of adopting a public health approach. To put things just in the primal language of basic self-interest. This is why a public health approach is important, even if you do not care about rights or ideals. There are more reasons of self-interest. Firstly, we want to minimize economic losses and disruption. And this is actually the basis of the POIS program that I'll describe shortly. And I'm sure MK in the next presentation will tell us about all the challenges and costs of trying to operate an industry during this pandemic. Next, by having foreign workers take on jobs which are complementary to us rather than substitutive to us. For example, let me just give a simple one. Looking after our children, cleaning our houses. This enables citizens to take on more productive, higher paid work. Foreign workers also take on jobs that citizens do not actually want. These are the 3D jobs, dangerous, dirty, and difficult jobs, thus filling in very important economic and even social gaps, I would say. But here, a public approach is important because it's in our collective self-interest also to ensure that there's a basic minimum safety and minimum basic safety and welfare standards for foreign workers. Why? So that it does not drive down workplace standards and wages for citizens. We do not want a race to the bottom. This is the next section, which is basically what are the broad principles behind a public health approach in the context of COVID-19 and foreign workers. I can't give a whole like a course on public health here, but let me just try to attempt a little bit of a snippet. And I would like to make this interactive. So we have Slido. We also have comments on Facebook and on YouTube. And I want you to interact with this. And I have a question for you. I would like you to look at this picture and just tell me, let's have a discussion. Where is health? Tell me, what do you see? What elements of this picture are about health? I'm looking at Slido and I'm looking at the comments chat. What do you see about this picture which tells you about health or the lack of health? Well, let me just start with one. There's a hospital, isn't there? It's in the background. Well, that is health, right? But it's only one part of health. What about the roads? Is that part of health? If you look at it, it's well structured. It's clearly marked, and I think whoever drew it is trying to make it look safe. Do you all see anything else which is about health? Someone has said health is everything. I totally agree with that. Yeah. All sectors are health. That's right. Look at the cycling. They've got dedicated cycle lanes to make it safe. They have green open spaces, lighted parks, so it's safe for people to be physically active in. I see that families and children feel safe. There's security. They feel that they're able to play and enjoy these spaces and to interact and to socialize. There's access to healthy foods. You can see that. Eco-green shop, yes. There's a green environment. These are very important, right? Access to clean air, clean water, healthy food. These are very important. It's not just the hospital at the back. I also see there's a hotel. So that means travel. So like a year ago, if I asked you what's the link between hotels and travel, you'd probably like, goodness, what's that? But now we understand how closely travel is to global health security. It's so obvious that we are living in a pandemic, but that's really important. Anything more? There's also businesses, isn't it? That's really important. Unemployment is a major risk for ill health, right? And that's one of the reasons why we thought about poise. So in other words, if I just summarize, I wish we could be more interactive, but if I just summarize, public health looks at the big picture across different sectors, all sectors if you like, and it all takes the long-term view. So we're just not looking at cases today and the impact of how many people get a COVID case today on the 26th of February. We're concerned about mental health impacts in the future. We're concerned about education in the future, because that's really going to affect health ultimately, and it's very important. So public health takes a look at the big picture across different sectors. It takes a long-term view. But there's another important public health principle which is particularly relevant to today's topic, and that is the issue of access. And this is an area where Malaysia has the opportunity to improve. It's in our self-interest that foreign workers get access to the same COVID-19 services that we do. So this particularly includes tests and vaccines, which are two critical parts of, if you like, kita jaga kita, in addition to the protection of occupational safety and health. And when they're ill with COVID-19, they need access to healthcare to be treated. Now, access has to be meaningful, not just lip service, meaning that it has to be affordable. It doesn't necessarily have to be free, but fees should not be any hindrance to anyone who needs the service. It has to be physically accessible. Perhaps this is more relevant to remote and rural communities rather than foreign workers working in cities. Some costs, and I put that opportunity, right, the opportunity cost, some costs may not be so obvious. If access to healthcare services is only provided during working hours, that may be a very costly barrier for people, and a costly opportunity cost barrier. Importantly for foreign workers is the fear, real or perceived, of discrimination, incarceration, lost job opportunities, and deportation that could come with access. Hindering access to any of these sets up perverse incentives. Incentives to hide symptoms, contacts, seek help very late, to run away, potentially bringing infection to other places and people. And this ultimately harms us. This is why access for all is in our best interest. Because without equitable access to all, including foreign workers, there's no kita jaga kita. It's just kami jaga kami, or saya jaga saya, you know. All right. This brings us to the final section, which is on how. How can we bring all these big ideas and implement them in practice? I'm just going to present a very narrow example of how we can apply a public health approach. As I mentioned, public health is very broad. It takes a long-term view, so I'm not claiming this program represents the whole of public health, but it's just a start. And please allow me to describe the POIS program, which is implemented in the state where there are most foreign workers. Firstly, by starting to say that it was not framed as a program for foreign workers, it was just framed as a program for all human workers, because that's the important part. This is a small step, as I mentioned. And POIS, what does it stand for? It stands for Prevention of Outbreaks at Ignition Sites, such as workplaces, which Prof. Adiba mentioned, account for, I think, more than half of the clusters in the country. Firstly, we made it such that it's a win-win-win partnership. Who wins? Employers, employees, and the general public. We developed it together with industry stakeholders. And it's a win-win-win because for employers, they get to protect their investments, represent their shareholder interests, protect their reputations, and minimize operational disruptions. For employees, they avoid getting sick, Perhaps they have more hygienic or better living standards and welfare standards. For the general public, we want to minimize spillover cases from these ignition sites in workplaces to the general public. We want to also lessen the burden on hospitals so that access for us will be protected. It depends a lot more on sticks. Sorry, it also depends a lot more on carrots rather than sticks. As it's in our mutual self-interest, the program is more like a carrot. We hope to attract companies based on mutual self-interest to commit and comply. Let me also say that as a benefit, that there's an added benefit. If we only had a stick and came to companies to check on SOP compliance and yield a big stick of a shutdown order or a fine, then the SOP set that we come up with will have to be a minimal set of rules that all industries can comply with, whether they're making microchips or chocolate chip cookies, right? And that makes the kind of SOPs that we can use a lot less ambitious. It has to be just a minimal set. It means there are a lot of lost opportunities to partner together to rejig industry operations beyond just minimal compliance, because there may well be very easy and cheap steps that a factory can take on, which may make a big difference on outbreak prevention. And these are the kind of things which are custom to each industry and to each factory and each type of manufacturer, which we also need to benefit from. And the best way to do so is a program like this, which is more carrot than stick. And because we are going with more as we're using more carrots and sticks, we're actually providing more supportive technical assistance. We don't go to companies bearing a big stick, but go as a technical partner, working together out of mutual interest to work out operational changes which can prevent outbreaks. And if an outbreak were to happen, to minimize its spread and minimize its impact on operations. This is for everyone's benefit. So in other words, POIS is another way of saying, let's keep calm, do our part, and carry on. POIS has 4 components. Health education, which is like the basic part of public health. An important part of it is to do so in a language which is understood by its recipients. It also includes a regime of testing, which understands that even if you test a person once today, I understand that they are rolling out tests for foreign workers as we speak. So you just test them once a day, but that doesn't stop them from getting COVID another day, even if they test negative today. And the purpose of this regime of testing is to identify outbreaks early, so and particularly by targeting super spreaders. That means testing potential super spreaders, so that you can identify an outbreak at its very early stage. The next part is what we call enhanced public health measures, and I have another slide for that, so I won't elaborate further. And of course, we have vaccinations. And I have to say that the news on the efficacy and the safety of the vaccine has been really very, very encouraging. And our vaccine minister is absolutely right. And he's applying a public health approach correctly when he's decided to include foreign workers in the national immunization program, because no one is safe until all are safe. And if anybody thinks that excluding certain populations from vaccination because they're undeserving, well, that's the kind of thinking which resulted in the polio outbreak in Sabah, which was a major embarrassment to our country, used a lot of our country's resources to deal with when we could have just vaccinated people. So that's really the downside of not having a public health approach. This is really my second last slide. I'm not going to describe all the elements of POIS in great detail, but let me just give you a sneak preview of what Prof. Farhan will probably detail in more detail. So the most important part is what we see on the top left. It's not about SOPs, it's not about whatever, it's about leadership, it's about governance. And to me, that's the most important intervention of this program. It's to elevate the COVID-19 agenda to the highest level within the company. So form the highest level steering committee so they can make decisions. They won't just face, even private companies I'm sure have bureaucracies, right? They won't face stumbling blocks and roadblocks within their company to get sensible policies out on COVID-19. And you need to have a designated and empowered, what we call a Scrum Master, to really lead this effort. And then you have these workplace bubbles, which is really a no-brainer idea. I think you all would have read about it or heard about it from so many other contexts. It's just basically to keep workers isolated from each other and ideally from the outside world as much as possible. So as an example, if you're working in one assembly line, just keep workers who are working in that particular assembly line who have no choice but to interact with each other, just keep them in their own bubble and prevent them from mixing with other assembly lines. So that, for example, if one person within that assembly line gets infected, you do not need to shut down your entire plant. but it's just the damage is much more mitigated. Same thing will apply if you're a construction site. You can try and limit the interaction of teams of workers so that they are within a bubble as far as possible. Now, it's not going to be possible in all contexts and all situations, because there are certain people who will have to work across work sites and across assembly lines, right? And so for these people, there are added things that you can do. For example, you can put them on a more rigorous testing policy. You can ensure that they maybe comply with a higher standard of PPEs, wear face shields, for example. The other important part is to mitigate the 3 C's, which is close contact, confined, and crowded spaces. To think about ventilation, to think how you want to manage risks when it comes to the use of shared spaces like canteens, toilets, elevators, shared transport. What are the kind of things that you can do where people really have to be a bit closer to each other for at least a short period of time? The next one is developing an emergency response plan, so that you have an immediate plan of action if there is a suspected case. And some of this might include having a temporary quarantine or isolation area, so that you do not need to wait for an overburdened Ministry of Health to be able to respond immediately, but you can already preemptively take on some steps while waiting for further orders from the ministry. And then most importantly is the living quarters. And in the short term, there's not much that can be done in terms of like just rebuilding a place, but you can still try and preserve the integrity of bubbles, so you can keep the teams who work together, let them live and work and rest and eat and play together. You can improve the ventilation, it's in the short term, but obviously in the longer term, we need to more comprehensively improve the quality and reduce the density. So let me just summarize. A public health approach means that we are all in the same boat. The inability to see the them in us is a value which is alien to us. It is the real kita jaga kita, not kami jaga kami sahaja. It's in line with our values and our faith traditions. But even if that alone is not persuasive, surely self-interest is a persuasive reason enough to use a public health approach. A public health approach looks at the big picture over the long term, considers socio-economic outcomes, education, mental health, dignity. All these are also important objectives and determinants of health. Therefore, a statement like lives versus livelihoods is really unhelpful in an approach like this, because both are important. Lives impact livelihoods, livelihoods impact lives. So they're really not separate things. For foreign workers, having equitable and meaningful access to all relevant COVID-19 health services is critical and in our self-interest. And these principles can be implemented in practice fairly easily, and I've just given you the example, with an understanding of incentives and behaviors. So it's not just about thinking about sticks and fines, but are there carrots that you can do? Are there win-win-win partnerships you can build? And I believe there are. Thank you very much. Sorry, I have one more slide, which is just to share some further reading for those who might be interested. Thank you very much.
Thank you, Wei An, for putting through that very persuasive argument on the need to take on a public health approach to dealing with COVID-19 amongst our migrant workers, and also on looking at if, as you said, if it's not for our collective values and faith, then at least for self-interest, which is not a very nice thing to resort to, but perhaps the two combined will get us somewhere.
Some may say that self-interest is also our value.
Yeah.
So it's still, everything is still consistent, right? Yeah. Whatever it is, public health approach is very consistent.
Indeed. Okay. Now we'll hear from Mr. M.K. Goh, who will share with us the real challenges that industries have faced during this COVID-19 pandemic. How feasible is it to employ those kinds of public health measures that we just talked about? So, MK.
Thank you, Prof. Morning, everyone. So I think maybe what I'll do is I'll speak from my personal experience on a few areas that we're speaking today. I think one of them is we're speaking on migrant workers, and I would like to share a bit of our own personal experience in terms of migrant workers. And then we'll talk about our challenges with regards to the COVID pandemic and also the business costs, that how it has impacted businesses as a whole. So, well, I would say that the experience that we've got in terms of dealing with migrant workers, Carex is an organization that's already been over 30 years in the business. And maybe just a bit of a background, we have our manufacturing sites across 4 locations, one over in Hat Yai in Thailand. We have a location in Port Klang and 2 locations down in Johor, one in Pontian and the other one in Senai. And basically, across all facilities, we have approximately 3,500 employees. And one of which, the migrant worker issue actually would have been quite highly debated in the rubber industry in the last 1 year. We had actually had a bit of an experience earlier with regards to issues that was highlighted in the media, in the foreign media, and Carex has actually been probably a little bit ahead in terms of where trying to understand the migrant worker issue here in the country. One that has made a decision on a current freeze. So we have actually freeze intake of migrant workers in Carex since January 1st, 2019. So it's been over 2 years now that we have not hired any new migrant workers, not because that, migrant workers are not, they're not involved in the development of Carex, but it's just because of the way the issues with regards to how migrant workers could very easily be trapped in a forced labor situation in our country here today. So it is a decision that we have made, that we have freeze. And what we have done as an organization, I would say in the last 2 years, was really to humanize the whole entire operation and to understand the issues of migrant workers across all levels within the organization. And I think we have been highly successful with regards to this approach in terms of how we understand migrant workers better. I think one of which we did 2 years ago was we looked into the entire the entire contract of the workers. And one thing we do realize that it was through interviews that a lot of workers actually don't understand what was actually written in the contracts, because one thing is very clear that when we usually hire someone in, contracts are probably in Bahasa Malaysia or English, and it's very obvious that most of the migrant workers are not they don't understand our language here, and we got them all translated, but again, when we found through the translation, in fact, actually, in some of our plants, over 80% of the workers were illiterate. So, we could do as much as we can in terms of trying to disseminate information through writing, translating them to a lot of information, but it's just not getting through to the workers. We have done a tremendous improvement in terms of the living and working conditions in the factory, because as a leader in the manufacturing of condoms globally, our products are being exported and we are subjected to a lot of requirements, global requirements in terms of living and working conditions. So we've done a lot of improvement, not just meeting the local requirements here in the country, but meeting up with global requirements. So that's basically a little bit of information with regards to our issues with migrant workers. And ever since then, we have been hiring local workers. Today, migrant workers probably constitute to about there are about 900 workers out of 3,500 workers. So they are not as big. And maybe I can explain a little bit more through our experiences with COVID. And with COVID, we have probably mixed different type of challenges, one which started more with the migrant workers, but I think of late we've been seeing more of the infections coming from the local workers. So maybe if I can run through a little bit in terms of COVID, in terms of our personal experience with all that were put in place. We had probably our first infection somewhere in November last year, and that was from a local local worker who contracted COVID through her husband, who was working in a different factory. So that was the experience we had, and that led to testing. And we have been doing periodic testing across our factories. We've taken a sample size of about 10% since November. We've been testing, and when we got a positive case, we would alleviate it to the entire factory, and that was how we started. It was awfully expensive. In fact, we actually even started with our first test using a PCR test. And then later on with advice, we actually went on to the RTK antigen test. But testing has been extremely expensive for us as an organization. I think till today, we have conducted over 3,000 tests, which is of all has been basically at the company's cost. So that's something which is on our experience. In terms of what we have done as an organization, we have been providing lunches and dinner since for a few months now, and it's one that every time when MCO it comes in, basically we would launch our food program, which we would have been providing food to workers. So we want to ensure that the workers do not go out too much to try to mitigate and reduce their exposure to other people outside. So what we have been doing also is that we've been doing a lot of open spaces in terms of food. So we have actually made sure that the car parks in some of our factories, we have actually brought in quite a number of tents just to open up the space and make sure that there is proper ventilation. But I think one of the things that we had actually is since our migrant worker issue in 2019, it's actually starting off a hostel sponsor program. So what we have been doing in terms of our hostel sponsor program is part of our humanizing space in terms of migrant workers to make sure that information is carried out through our factory. We have a manager basically involved with every group of migrant workers, which is probably in a group of 20, so that they have access and they could speak to someone just beyond the HR department. And anything is something that they are able to open up to speak to their sponsor. And we found that highly effective through our sponsor program. If there is anything we request them to do, that information goes very quickly to them. I think maybe if I can run through a little bit of experience, which I've actually shared with Prof a little bit, sometime when it happened. I think we do find a lot of misinformation across the different sites here in Malaysia. Between our operations in Klang, in Port Klang and the Selangor state, and Johor, it's very different. And one of them, I think, was how the Kementerian Kesihatan at the different locations behave as well. Because even when we were doing our first test, or when we found the first positive case in Johor, and we were required to test all workers, when the workers were tested in batches. So what happens even with the first batch of workers that we suspect, it was a batch that we tested, and unfortunately, well, our general manager, who was not living with them, was no contact with them, but just because the fact that he was tested within the same group and they were in close proximity, he was actually ping tagged as well, and he was asked to be quarantined. So those are some of the things that we do find, and of course, with regards to a couple of cases we had in Johor, it's very often that we were asked to shut down. So we had to definitely be constantly in communication with the local health authorities. And we do see a lot of difference with regards to how, you know, people within, in our location in Pontian, it's rather small town, the the behavior of the people are very different. So when we have our hostels as well, when they're very close to food places or traders, when we had cases of workers who had information spreads very quickly in the town. We even had multiple traders writing to us asking for compensation of loss of business. So that is definitely one which is something that we have to deal with. But we would have to constantly having that communication, and how we manage that communication is actually very vital. And I think on my third part, in terms of this bit of sharing experience, is definitely on a business cost perspective. On a business cost perspective, definitely I would say that COVID has one which has had been extremely disruptive in terms of a manufacturing business. We have seen a lot of loss in terms of operation in the last few months. I would say that we have easily lost 30 to 40% at times of our capacity, because of people who were sporadically finding to be COVID positive, and with the close contact. And the moment once close contacts comes in, and it's again, how do we define close contacts? It's very often that we see multiple departments get shut down, and when multiple departments get shut down, the entire operation gets affected. So we do see a huge loss in terms of operational capacity. The cost in terms of business obviously involves a huge amount of purchase of PPE and testing costs. I think we've spent over a few $100,000 over just the last few months on testing, which I definitely am one that is hoping that testing cost comes down, because I think if we want to win this war with COVID, I think testing is extremely important. We all agree that it's extremely important, but it's extremely expensive right now. It has to be reduced, because one of which Carex has our operations overseas as well. So we have our own two subsidiaries, one in the US and one in the UK. And when we find out how much test kits cost in the UK, it's sometimes it's just something which just shocks me in terms of how much we pay here in our country. We pay easily over 100 ringgit with the RTK test, and with the PCR it's coming to 200 ringgit per test, whereas a test kit would just cost probably about over just $5 in the UK, that one that our subsidiaries have their hands on. The other area that has definitely one that has been extremely disruptive for us is definitely working from home. I think working from home is definitely a great idea, but I'm not sure how are we basically coping as a nation in terms of working from home. Work from home, it works well in our US operations. They have actually started working from home culture way before COVID. But when COVID affected us and we started to talk about work from home, it is extremely challenging. It's not that we don't want to or we don't encourage people, but it's just the fact that facilities are not available for working from home. If we talk about internet access is a major problem. Even in our largest plant in Malaysia, we don't even have a fiber optic internet connection. And obviously with our employees who are working in a lot of other smaller towns, it's basically very difficult for them to get internet access. And I think what earlier Dr. Yap was actually mentioning, about health, where it's health, it's everywhere. And I think internet access is very important to make sure that it's there. one of the major costs that we have also is in terms of purchasing of laptops. We have actually purchased probably over 100 plus with laptops in the last few months, last 1 year. It's a lot of cost in terms of associated with IT upgrades, because for our workers to basically access the servers and making sure that it's in a world today where internet access is sometimes, or security is actually a concern, making sure that they get a VPN line, it's also something that is actually very challenging as an organization. So I think in all, definitely the impact or cost impact to any organization in this COVID situation is extremely expensive. One which I think the world is going to see, and I think I'm also concerned for the fact that as one of the largest, as the largest condom maker around the world, we can see that impact towards us as an organization, and I'm afraid with situations where we would not be able to deliver condoms to certain communities fast enough, it would again be a associated COVID cost, I think, in the longer term. But we have definitely one where we have been seeing major disruption in terms of our supply chain, not just us as an organization, but we're starting to see it across our suppliers, both locally and some internationally. And I think what we are seeing in terms of the disruption internationally, it's definitely one which has impacted a lot of freight. Freight cost has gone up a lot. Shipment costs has probably gone up between 300 to 500% just in the last few months. And I think all this impact will be seen. People will definitely have to pay that cost very soon. But that's what we've definitely been seeing from a manufacturing perspective or from a corporate perspective. So I think that's probably all I would like to share, Prof. But I'll definitely would like to, we'll definitely take more questions later on.
Thank you very much, MK, for sharing with all of us the very real challenges you as a leader in your organization trying to overcome all the challenges of COVID-19, not just in ensuring that you minimize the infections in your factories and in even on the administrative side of the organization, but also the hidden costs. I think thank you for highlighting that, because I think many of us actually don't think about all the hidden costs of working from home, and what it actually means to the organization. But of course, all the not so temporary disruption that happens every time there is an infection, and the need for much more coherent policy nationwide. So we have some questions, but we'll take that at the end as we hear now from Dr. Farhan, who will discuss on how can we implement the ideas around POISE and make this as effective as possible for the likes of CAREX and other organizations. Farhan?
Hi, thank you for having me. Do you mind sharing the slides, please, Huda? Thank you. All right, so I'll be talking about on the implementation of the enhanced public health measures as mentioned by Dr. Wei On. So basically, this is from what is happening on the ground and the experience that we have faced, and what are actually the drawbacks, or what are actually the resistance that we are facing when we actually, rolling out and implementing this program. Next. I think there's a previous slide. So the basic principles are as such. The plan is to encourage the adoption of the enhanced public health measures as entailed by Dr. Wei On. We want to increase the awareness. We want to bridge the gap between employers and staff. We want to identify workers and who are at risk, and we want to provide solutions for all related public health issues. And this guiding principle does not take into account or favor any ethnicity, any nationality, because the way we would like to move forward is to ensure that the accessibility of health, the accessibility of a public health measure is to all peoples. Next slide. What do we do actually? Through engagements, we ask these people to establish a steering committee for COVID-19. We appoint designated COVID-19 Scrum Masters and formation of internal bubbles whereby they are able to work if they are categorized as a bubble who were a close contact, so they do not actually mix with other people. We help these industries identify and mitigate risk and also develop an emergency response plan. Next. Okay, this is the physical implementations that we actually help with. We modify the layout of the factory or the industries itself. We talk about the ventilation aspects in their dormitories. We establish designated temporary isolation areas for these people. And we talk on the situational based enhanced public health measures, such as a traffic light system that they may implement in their area. Next, please. So these are the issues, and this is actually what I want to talk about. The previous slides was just giving a brief overview of what it actually is. Number one, when we actually go to the ground and we talk to these people, everybody seems to tell us that they do not have money. They seem to tell us that there is a financial issue. And it's very sad to see that because of this, a lot of the foreign workers, whether they be legal or without documents, are severely impacted in this. This is because when they claim that they do not have money to provide proper public health measures in place, they basically tell the workers, you can actually go out and get yourself tested if you see any community screening being done for free. You can get yourself isolated wherever you can. We're not going to help improve your dormitories and all these things because we are actually losing money. And I think industries need to understand that there must be accountability. For me, when implementing this type of public health measures, the buy-in is not only from the workers itself first, but it must be a buy-in from the industry. Now, I'm talking about one aspect of it, and the other extreme end are industries who go leaps and bounds trying to improve the infrastructure for their workers, regardless whether they are foreign workers or migrant workers, or whether they are workers with permits or not. And to me, what it shows is that it can be done. It's the onus is on the employees itself. And I think time and time again, the government has actually given a lot of guidance and given a lot of laws stating this. And I think Adrian mentioned earlier where he said that we now have to give leeway and we have to give way for the workers, or to give a moratorium so that we can actually proceed with our public health measures. We can proceed with our vaccination programs and rollout so that they are not cowed into a corner, or they are not, forced into a certain area. And I agree with this. However, I think that the focus of the government and the enforcement should not be on the migrant workers. It should be on the employers. Go after the people who are actually hiring these illegal foreign workers, who are not making it easy for these people to live in the country, who are not renewing their passports, who are taking shortcuts and telling them not to renew their PLKS and their visas because they would like to save a few bucks here and there. And when you go into a migrant community and you go into foreign workers, you have to look at the head. Who is actually running these people? These are the people that you must actually get down to business with and actually catch, right? Deporting 1,200 Myanmar nationals, where it was a sensationalized issue after the court order was placed, to me was not the main problem. What I wanted to see was who were the people who were actually hiring these migrant workers, who were giving them work and actually encouraging them to stay. Now, the problem is a systematic one, right? We're talking about poor governance from top to bottom. There must be a reason why we have an over influx of foreign workers coming into our country. There must be a reason why migrants are actually roaming freely in our country. I'm not talking about refugees. I'm not talking about people who overstay. I'm talking about people who have overstayed and then they have come in again and again and again. And when you investigate, they have actually crossed our border 3 or 4 times. Right now, you are touching things on border security. Now, these are things that you should be looking and focusing on, not on the people who are already inside the country. So, for the enhanced public health measures for the migrant workers, what we are doing on the ground is that we're giving empowerment. So when we go to the ground, when we go to the factories, when we do screening, when we register them for the prioritization of vaccination, because that's what the Selangor state is essentially doing, we give them a unique ID so that these people are not stigmatized, they are not labeled. We do not know whether they are illegal or not. So that doesn't, the onus is no longer on our team to actually report, because we are absolutely sure that we do not know who they are, right? We do not know whether they are legal or not, because we do not ask for that status. And it's not our job to ask whether they are legal or illegal. Our job is to ensure that public health measures are placed. Our job is to ensure that everybody is protected and vaccinated. And we think that this is the only way that we'll be able to address the foreign workers and the migrant workers issues when the pandemic is in our country right now, especially as we are approaching towards or we are aiming towards herd immunity. Can we go to the last slide, please? So our recommendations from our side is a need to provide targeted financial assistance to address issues of foreign workers. When I say targeted financial assistance, we have heard so many stories of where industries have been paid a lot of money to cover the workers' wages, but the workers did not get those benefits. So we need to address issues of governance. So comprehensive planning of designated housing. I think what was mentioned by a few of the ministers last couple of weeks ago was that they were going to crack down hard. They were going to make sure that everybody was now housed in a proper manner, that a new framework was going to be developed. For me, the question is simple. You tell the people, or you tell the employers and the industries that they must house these people. Do we have available, ready infrastructure to do so? All right. Are we giving these places at affordable rates? Right. So if these people have already been paying only $50 or $150 a month, and you start charging them $500 a month, definitely your plan will definitely fail. So I think giving or changing policies or restating the obvious but not providing solutions is not going to help anybody, the industries, the foreign workers, or even the enforcement officers, right? You do not expect enforcement officers to keep on going to the same place and then issuing summons and compounds, but there is no benefit on that, right? We have always been a society whereby we punish, but we have never been a society whereby we enable, we empower, and we assist. Now, the support system needs to be addressed. When we talk about and compare to our neighbors, people get angry. They always say, if you always praise Singapore so much, why not you move there, right? We always hear these things. But this is a mentality that is actually causing our nation not to actually progress. So when Singapore rolled out their housing policies for foreign workers, they actually engaged the industries and helped them instead of issuing compounds and then punishing them, because they knew that if they did not help, these industries would not be able to solve these issues themselves, right? And we think that there must be a continuous monitoring and surveillance. So in this essence, what our public health measures do is we focus on continuous surveillance, which is actually a bit lacking or absent in the current health ministry itself. And we want to talk about effective risk communication. So when we say effective risk communication, I am not sure. I am not sure if everybody who's looking at this has been on the Singapore website for vaccination policy. If you have the time, you just need to Google MOH Singapore, You look at the vaccination and you will see 4 different languages, which is already on the platform. All right. Because it is a holistic implementation. They do not leave any groups out. Compare it to our side, how many languages do we talk about? What about our risk communication when we talk about places which do not understand Malay or English? Because we do have ethnic Chinese, right, in our population groups who do not understand Malay, who do not understand English, let alone read and write, right? Are we moving on this risk communication to these areas? And when you touch on the issues of foreign workers and you want to achieve herd immunity, definitely you will need to explain the vaccines, the immunization, because the problems faced by our citizens are also problems faced by the foreign workers and also the migrants, right? If we have anti-vaccine movements among our population, we also have anti-vaccine movements amongst the migrant and also foreign workers. And we need to address this issue as well, right? Putting them aside does not solve the problem, does not solve our nation's pandemic, and doesn't bring us on the exit road, right? It brings us on an infinite loop whereby we do not have any issues solved, right? And this is why when we talk about effective risk communication, we must ensure that the effective risk communication covers every single person who is actually in our program and in our country. So this is what Selangor State's doing. We actually engage with UNHCR so that our message gets across to the Rohingya community. We are trying to engage with other associations so that we may translate these things into the language spoken by the Myanmar nationals. And we think that only in this way will any implementation of public health policy actually be successful. And the failure for us to comprehend or have insight or understand this very, very important point will actually not allow the country to exit the current pandemic. Thank you so much.
Very passionate discussion and on the issues surrounding our migrant workers and population, and some of the more difficult interventions that need from the higher ups if we're really serious about controlling the COVID pandemic. And as well, I often believe that COVID-19, which has really amplified and magnified the inequalities and inequities that exist around the world, it's a good time for us, I think, as a nation to reflect on who we are and what our values are, as Wean so eloquently said in his presentation, and really use this time to reset, because even if it's not for even if it's not for to improve our values, and as you said, to instead of the punishing approach, but have a more enabling and assisting approach. It really is in the self-interest, because otherwise we will not successfully get out of this pandemic if we don't do it more comprehensively and more compassionately. Now let's hope there are people out there who are listening to us. There are certainly a number of questions, so thank you very much to all the speakers for sharing not just your experience and your thoughts, but also to some of the solutions and the way forward. Some might be easier than others, but hopefully collectively we can continue to advocate to those who are empowered to do something. Now, there are a number of questions. Perhaps we can start off with the practicalities of vaccinating. I think that's a good a signal, a good first start to being more comprehensive, but in terms of the public health response. But as we all just heard, how practical is it to reach out, particularly to the undocumented migrants, given the unfavorable and enabling environment that they work in and live in? So the first question is from a person called Lei. Perhaps I can address this to you, Adrian, or even to Farhan. Can NGOs that have been working with and trusted by undocumented migrants in Malaysia be trained to administer COVID-19 vaccines?
I think Farhan, you want to attempt first?
Yeah, sure, no problems. I don't think there is a need in our situation in the country for you to train the NGOs. Honestly, I think a lot of times the NGOs should be training some of the health ministry staff. Number one, the NGOs have already been engaging these migrants for, since eons, and they have always had access. They have opened up clinics. I'm talking about Mercy, MRA, MRED, Suchi foundations. They have expertise. Some of them even hire those in the local languages. So the vaccine itself does not need any training. It's just an intramuscular injection. All right, it's the basic bread and butter of medicine. There's nothing for you to train except for perhaps a technical training on how many times you need to shake and bake the vial. So I guess this is something that can just be done online, or it's something that you can just put out on a piece of paper even and laminate, and people may follow simple instructions. For me, what is important is the question should be, how fast can these communities get the vaccines? That should be the question, rather than asking whether they do need training or not. Because I don't think they absolutely need it. They're actually well trained.
Thank you for that. Along those same lines, given the fear of arrest and deportation, can these NGOs be brought in to assist with the national immunization program? And if I may add, are you all being roped in to assist with you all meaning Imaret and Mercy and such like? Are you all being roped in to assist with the vaccination program?
Well, like how it's always been in this country, right? So the announcements have been made, but nothing's moving on the ground. So people are making noise up top, and they are making all these fantastic policies which nobody actually on the ground knows about. So I think everybody is learning it as much from the Star or from the New Straits Times. I'm learning it as the same time as you, because we are waiting for the engagements to happen. And you know what? I don't blame them. Vaccinating the frontliners now itself, I think they are probably having their hands in melted butter. So we'll see how that goes before I think they can focus on other focus groups, other focus areas.
Okay, fair enough. Adrian, any experience on your side?
Yeah. So there's already a big trust deficit between the government enforcement and the migrant community. So that trust deficit has to be bridged, and there should be a legally binding black and white agreement that a moratorium on raids and detention has to happen for the migrant communities to come forward. In this case, I think the embassies would be the most trusted agencies to help roll this out. And in the long term, like I shared, there should be a decriminalization of irregular migrants, and just look at it in the terms of administrative impact. Yeah.
Okay, thank you. Staying on the question of vaccine and how to ensure that the rollout to both documented and undocumented migrants is successful, given the trust deficit that you mentioned. The other thing that was discussed by some of you is also the knowledge and the information deficit, right? Simple things like language and of course the cultural competency in engaging with the different ethnic groups that make up the migrant workers. Do you know if there are any, there's a question here, do you know if there are any serious efforts being made, whether in written or in audio, visual, informatics that's available?
Probably, but if I just interject here for a while, if it's all right. You're asking whether there's any information that's being given out. But I think one thing that we need to know as a country is this vaccination going to be made available to the foreign workers? The foreigners and the migrant workers are actually going to have access. As you know, there was contradicting statements that were made. One saying that it's going to be given free for all, and 2 days later, after 48 hours, somebody else said we do not need to vaccinate, and there is no need to vaccinate foreign workers. So I think the issue stems down to actually poor governance in this essence. How are we supposed to plan a vaccine rollout if we don't even know, are these people going to have access to it or not? I don't think the question is whether it's going to be provided free or not free. Our question is simple. Do these people have access? We can find the money. We can find solutions to get these people vaccinated. But before that, we need to know, are there allocations already being given to this high-risk group? And only when we know that will we be able to actually plan and roll out on our health promotion campaigns on getting these people vaccinated. Imagine us selling them an idea that they will never be able to touch or never be able to have access to. So I think this is something that we need to address.
Yeah, I think there was a correction, wasn't there? That in fact, the Minister for Vaccine gave his, clarified that yes, both documented and undocumented migrants will have access to the vaccines. That's how I understand it. I'd be interested if there are any others in the panel who may have other knowledge about this.
May I make a comment?
Sure, go ahead.
Yeah. So if you look back at the Singapore experience, so from the overconfidence of having the golden standard, in a matter of weeks, they just exploded into a crisis. So I was looking at the Singapore government system of how they manage. So very systematic. There were apps with information translated into different different languages, very clear SOPs. And I think after a few months, they managed to get things under control. But it was very good cooperation. There were a lot of cultural communication competencies involved in bridging this information gap. Of course, I know Singapore can also be very kuku besi kind of governance, but they made it in a way that the industries and the migrants have a win-win solution. The problem with the governance in Malaysia, and I'm sorry to say, there's a lot of SOPs that are not made public. Personally, in my cases, people have died in detention centers because the SOPs are not made known to the public. And I'm afraid that if we don't change this culture of governance, things are going to get out of control again. Even the recruitment process, I think, Mr. Goh, you know how there's the competition between MOHR and KDN, and it's in the interest of transparency and accountability. If we don't see SOPs being made public, we are not able to hold accountable the people who abuse these processes. And I'm afraid that we're going to see the rolling out of vaccine face these problems.
Hi.
Okay. Thank you for sharing that, Adrian. Wei An, please go ahead.
I was going to comment on the vaccinations for foreign workers. I suspect that those who have proper documentations, at some point the policies will settle and you'll be fine. I'm more worried about those who are undocumented. And I think we do already have the precedent, even through HIV, I'm sure you know very well, about governments, not just Malaysia, but many governments just working through NGOs for people who, at least on their statute books, are doing something which may be considered illegal. So I think that precedent already exists, that we can work through NGOs to deliver vaccines. But let me just bring up 3 technical issues. One is we have to realize that I don't think there will be a huge black market for vaccine doses, because it's already going to be offered for free to citizens. So if you give vaccines doses to NGOs, there's no need to be worried that they're going to be trying to sell it on the black market and give it to other people, because it's already going to be free for other people. It's akin to, and we have NGOs which are so trustworthy, dealing for a lot of money, and PPEs which also have, in a sense, market value. And so I think the reputation of these NGOs is quite strong. So I think we should lay to rest the risk that if you just give vaccine doses to NGOs to deliver to undocumented migrants, that you just be squirreled away and sold on the black market and given to people. Don't forget, we are already offering vaccination for free to everyone else in the country. So I don't think that's one problem. Another technical issue is, what about vaccine safety surveillance? So how do you track adverse outcomes, which might be useful to track from a global perspective, right? Just so that at least you can say for sure whether that we have got solid data on vaccine safety use after it's been expanded, right? So this is a global agenda. So I think for this you can work with technical partners, and I think like groups like the Selangor Task Force operations people have got the kind of data analytics and do not need to collect personalized information beyond what is the minimum required to administer vaccines. And then I think the third point is, do you choose a one-dose vaccine or a two-dose vaccine? So I think that might be advantageous if you just have a single-dose vaccine, you just jab into their arm, and then you do not need to they may be afraid to come back again, right? But if you're working through NGOs, I don't think it's a problem even to give a two-dose vaccine. But anyway, we are hearing good news that potentially even for some of the like for example the BNT162b2, which is also known as the Pfizer-BioNTech vaccine, even if after just one dose, it is actually quite efficacious. So some of the promising data is actually looking quite optimistic.
Thank you, Wei An, for highlighting those technical concerns.
So if I just summarize, it's just basically there are solutions. And we should not be too pessimistic about thinking about the worst of NGOs and they'll try to steal the doses, sell it, etc. I think they are very basic, simple solutions, and we should not be concerned about those issues.
Exactly, that trust deficit word again, that trust deficit term again, whether it's government and migrants and with governments or governments with NGOs, it's something that, or the public in general with the government, that's something that we need to seriously work on. Just to insert a bit more science, that the other interesting thing about the latest vaccine scientific research is also perhaps in those who have been infected, and in our case, quite a large proportion of our migrant workers have had infection, that even just one dose, as you said, is going to be enough, especially for those who've already been infected. So there are all these things that we need to keep pace with that could be making our vaccination rollout a little bit more simpler, as you said. Now, I have some questions directed to you, MK. Perhaps more for you, speaking as the sole representative of the employer sector here. Not all companies are as ethically conscious as what you've described. So how can we monitor and make it attractive for employers to treat their foreign workers better?
Well,
any insights from you?
No, I think it has to be all the way up within an organization. You have to, any change has to be all the way throughout the whole organization. And I think in our own experience, it was a culture change that we had to accept. But I think over here in Carex, it's just that we're very big on diversity. We all believe in terms of diversity, in terms of people and their decision, and I think it's all about respecting everyone else. It was definitely something which, in our own experience, there were even a lot of resistance initially, because people were then saying, "It's why are you then treating migrant workers better than even the local workers?" I had that posted to me as well. But I think it's all where we then believe in terms of the whole concept of diversity. We are also one that basically we have a celebration of pride within the organization as well. It's little small things that we do, of which we have actually created even a third gender toilet within our organizations, because we believe that those who are not sure in terms of what gender toilets they want to go. So I think it's that little small things that we just have to constantly push. So then it takes time, and eventually people will realize that.
Great. So I think we hope that you can be an inspiration to other organizations. Certainly, it's also not a matter of having the resources to do this. What I mean is financially to implement some of the much needed changes, but also the will and the culture to do it. Adrian, do you have any thoughts on this?
Um, I mean, the question of resource is going to come up again, but this cost is already taken care of. I really hope that we bring the migrant leaders on board and get their feedback on how to manage this whole rolling out of the vaccine. What's going to happen is they know some of the gaps. They know how the current healthcare system works. They know the limitations in movement also that are imposed by some employers. So it's important that we still go back to them. If G25 or the authorities can give them a caucus, a safe caucus to give that feedback, it will be very useful.
Okay, thank you. And another question to you, MK. I think there's been some recent changes to the laws, to Acta 446, to ensure that living standards are adhered to, and also for employers to pay for the cost of accommodation and food. How feasible is this going to be, do you think? I mean, it really shouldn't be a question of feasible, but how well do you think this can be implemented from the employer's point of view?
Yeah, for us, it's definitely we have to comply. We have already complied. In fact, for us, Carex, we have not deducted any workers' accommodation, even though we were allowed for a 50 ringgit deduction since January 2019. We have actually made that, but it is actually not easy. It's very tough as an organization, and I think this is something that Malaysia would have to think about as a whole in terms of, we always talk about sustainability. We talk about sustainability in an aspect of environment, but what about business sustainability? I think business sustainability is very important in terms of where organizations need to make profit. I think we all need to realize one that Malaysia is no longer a low-cost manufacturing country, and we have to then post the right message, or I think the government has to post that right messaging. What should be the direction for the country? Because it is a lot. Because it's no point making making something mandatory where it's not achievable. Because I think the whole issue of migrant workers, it has been there. It's been there for a very long time. For what I know, at least over 20 years as an employer of migrant workers, and it has been systemic issues that needs to be addressed within the hiring, and making sure that the whole process is clean. Because in the end of the day, it comes back to the migrant workers themselves. They are the one who, if they have no voice, and they are not able to voice for themselves, they would be the one who would be exploited. And that's why it is very easy for them to fall into these traps, a forced labor trap. I think there have been definitely a lot of tools that can be used, whether organizations would have to be constantly undergoing a social compliance audit that will definitely look beyond just the quality of management system within the organization, but to seek for areas where forced labor comes in. But I think in the end of the day, it's also very important, and I think the whole community has to understand. For us, for me, even myself personally, a few years back, I don't even understand the whole issue. And when we think about forced labor, we only think about people in shackles, or if you're chained or if you are in cages, right? But I think the whole concept has changed. I think it's very important. I think information has to be outside there for people to understand. And I think it's really no shame for any organization to sometimes come out and actually, admit that there were, there are rooms that any organization can improve. But I think that's one which, we as an organization, CAREX, came out 2 years ago. And I think we constantly think that there is still a lot of areas that we can improve as an organization. But I think in the end of the day, imposing things like the ACTA 446, it's definitely one which is very challenging. I know that I've spoken to a lot of my fellow industry friends, that a lot of them thinks that they will be out of business. If this is being imposed, because how fast can an organization actually increase their price to cover for all this additional cost? Because we're not just, Malaysia is not just one where we are one of the top exporters around the world, and we have to keep ourselves competitive. But and I think understanding the issue, it's key. I think whether is it fair to say that you want to just impose enforcement within a very short period of time when the problem has been there for a long time?
Sorry, Mr. Goh, I just need to make a bit of correction. I think the accommodation law, the government did give some leeway for extended, so it's not something that is sudden.
Sure.
Now, I mean, we understand that finances and reorganizing a chain will be a bit difficult, but I go back to my earlier point that the migrants have been paying tax. It's all dumped in the government treasury. Nobody really knows how this resource is being used. Now, I'm not saying that we have to take all that money to help the companies restructure and come up with new accommodation, but the architects have already said that it takes a few weeks to do this. It can be done from renovating current accommodations to finding new shop lots, and I've seen that happen. So I think more collaboration needs to happen. But I don't know, the resource, I still feel that the taxation migrants have already paying has to come back to them. So when the government did the retrenchment compensation scheme during to retain workers, migrants were not qualified to get access to this compensation. But where's all that levies and the taxations, the recruitment fees? Who's keeping all that money? So the question of money shouldn't come up. I hope the private sector, you find a way to talk to the government or the treasury and get access to this money. I just think that money is not the core reason for rolling out these solutions. Thanks.
Thanks, Adrian. Which just makes me wonder how much engagement MK and Adrian with the relevant stakeholders that took place before any of these policies were decided or even the ACTA changes were made. Do you know?
I think go ahead.
Go ahead. Yeah.
So from the I think for labor issues, there's a National Labour Council, and I think the MEF represents the employers' concerns, the trade unions represent the workers' concerns. NGOs, we are called only when there's a crisis of anti-trafficking or forced labor, as if we don't have any other skills. So I think that's really problematic in the engagement. Unfortunately, the government doesn't look at us with the same lens as Mercy or the other healthcare providers. But we do engage with auditors, with the corporate social responsibility, global auditors to try to fix these solutions. Hopefully that more inclusive engagement can be done when they roll out certain laws and policies. That there's still too many firewalls between us and those processes. Thanks. Sorry, Mr. Goh, for cutting you. Sorry.
Oh, no
Thank
worries.
you for that. MK?
Yeah, Yeah, I think yeah, that definitely there were consultation with the with the associations, but sometimes the problem is that what I see is that a lot of the associations are sometimes being represented by the larger boys, which usually would have no problem with regards to meeting those requirements. I think what my concern is definitely is the really small SMEs, who is already struggling, and they are the ones who would not be able to survive, or they would not be able to do that. So we do. I think that's where it's important. I think it's it takes time. I think it that definitely. I think I agree with what Adrian has said. The government has given enough time, but the larger corporates do understand that, but it's the smaller ones who doesn't understand that. Would definitely see an impact, or they trying to see how, or probably I don't know. We have to think of a system where maybe the larger boys would have to help some of the smaller boys in terms of trying to understand this issue.
Yeah, thank you for that. There was a question since you're on the mic. MK, has this been worth it? All the changes that you've had to put in for currents?
It is extremely expensive, of which it has impacted our profitability. And I'm happy. I think I have a board that understands and the needs of the organization. We have, because of that drop in terms of profitability, we have definitely been punished by investors, where we have seen our share prices drop. But I think the good thing is that I think this year we've been included in the FTSE for Good index, and I think that's what's important for investors moving forward. I think it's also important that we do understand that I think the ESG index is one which is going to be very critical in the coming years. So that I think it's an education for the rest of people that they should be probably investing in organizations who have who performs well in the ESG index, so not just profitability.
Yeah, I think that's going to be the carrot that we've been talking about this morning as well, isn't it? Farhan, and to a lesser extent, I guess, there's a question, from someone who says that we hear a lot about what Selangor State is doing. Why is the federal government not taking the reins on this? Is the federal government not handling this? Perhaps you can share with our viewers some of the efforts that you've taken to engage MITI and SOXO and others.
I think, yeah, I think I'll probably answer this. I think we all can add in later, I guess. What people must understand is that the state government is not taking over the federal government. There's absolutely no way that we can do that in terms of manpower, logistics, and all these other things. I think what needs to be understood is that the state government can be compared to other state governments. I think that's what you should be doing. So as we know, that the initiative done by the Selangor State is something that is commendable, and it is also complementing whatever the federal government is doing, so that we have a more whole of government and a whole of society approach, and we include every single level of government and authority bodies in the state to ensure that everybody is on the same page. And I think we have worked very closely with MITI. For your information, Dr. Wei On's proposal on POIS has been very well accepted by MITI, because it actually speaks on the same basic issue, which is the public health enhancements in all these industries. So we have never said that the federal why the federal government has not done anything for Selangor. You have to understand that there are also limits of federal powers and also limits of state powers. But why you see the Selangor state government being in the limelight, or in the always being highlighted, is because the state government is doing something with the federal government. And I think that going down the road, perhaps the question should not be Selangor government versus federal. It should be, why are the other state governments not following what the Selangor government is doing? Thank you.
of you're trying to bring in MITI and SOXO in this, there's certainly been a lot of effort. Am I right?
Yeah, correct. Well, initially, everybody thinks that we are going to take over their place, I guess, essentially. But when we explain, when we engage Perkeso, when we explain MITI, and we're saying that, look, whatever your plans are, we are here to actually be the synergists and be the bridging gap. Because we always tell all the federal ministries that the ones who are closer to the industries are actually the state governments and the local councils. So these are the people who are always with these people anyways. And we have engaged these people, we have engaged Perkeso. As always, whenever you knock on someone's door, they know who open on the first knock. But if you keep knocking again and again, eventually they'll get fed up and they let you in and they say, so what's up, right? So I guess that's the approach that we have taken. We have knocked on everybody's doors. I don't think there's any doors left for us to knock down anymore. So I guess that's the way we should do it. And I guess in any pandemic response, we cannot be complacent. We cannot give up in the first try. And I think this is the same mentality that we're going to bring in as well for the vaccination programs, for the vaccine, for the migrant workers and everything. And that's why you see Selangor State being very, very proactive in ensuring that we procure our own vaccinations to ensure that everybody gets vaccinated, regardless of what anyone says, because we think that health should be for all. And that's the way we approach things.
Okay.
I guess the only thing I'll add, sorry, yeah, Prof. Adi, but the only thing I'll add is just that we have shared the DNA and the kind of technical documentations for POIS, not just with the federal, but also with at least one other state, and just happy to share. It's not a secret. Public health is not something that you try and keep ideas to yourself. It's best if everybody does it, So
Correct.
We have to apply the same principle to ourselves.
We have gotten enrollments from Penang, from Kedah, from Terengganu, from Johor. So I think other state governments should take the onus on them. And you know what? If these people are going to the Selangor state government and asking for help, I think there's some sort of deficit somewhere, some sort of gap that they need to be addressed. I'm not trying to point fingers saying that we are better than anyone else. I'm saying that the way we look at things is that it seems as though we're the only one who's doing something, So I think other people should step up, and everybody needs to, bring their food to the table.
Okay, thank you. I have a question. I think this I can direct to perhaps Wei An and Adrian, who might have more regional knowledge on this. Question from Tan Sri Hasmi. Other than Singapore, as mentioned by a panelist, how are other ASEAN member states dealing with the same issue? Do we know? Around vaccination, around even simple public health measures for documented and undocumented migrants. Farhan, you two might want to chime in.
Okay. Maybe I'll just share a bit that if you look at Thailand, even though they also share a border with some of the other Mekong countries and this movement, they still offer social health care protection for irregular migrants. So the strategy is you provide some kind of insurance system to undocumented or irregular migrants, and you have them on paper. So you are able to monitor. Of course, there is a security reason behind that, but you also provide the healthcare service. Currently, you go, if an irregular migrant goes to public hospital today, okay, immigration will be alerted. Fortunately, there are some migrant-friendly doctors in our public service who don't do that. And I advise everyone, please put a firewall between healthcare and security service. It's going to backfire. The other thing that kind of amazed me was the big protests in Thailand and Myanmar. How did they do that within the COVID-19 pandemic? I mean, something they must have been doing to curtail the pandemic issue. So I don't know. I think we need to study that a bit more. And before I forget, I just want to raise the issue of getting diaspora communities on board. So Malaysia has this complex where, despite being a country of immigrants, we treat migrants in a very terrible manner. But there are diaspora groups who are permanent residents, Malaysian citizens, who have huge umbrellas, who can also help in bridging that deficit gap, or the trust deficit between migrants and the government in rolling out the vaccine. Yeah, thanks.
Thank you. Farhan or Wean, do you have any other knowledge of what other countries in our region are doing?
Probably not so much, but I just want to mention that on the vaccines front, that I believe COVAX has allocated a certain proportion of their global stockpile for, I can't remember exactly the phrase they use, is it emergency reserve, but it's basically for refugee populations and people who are in a kind of situation where they may not be well covered by national authorities. So I think certainly at the global level, there's a recognition that, you know, it's kita jaga kita at the global level, where no one is safe until all are safe, and so there people are trying to look out for the most vulnerable among us, who, you know, and it's very good reason, because very likely these people are going to be living in areas where they are going to be very close to each other, full access to healthcare. They are the kind of people, even if they're young, but a lot of them may not be young. You know, they may be traveling with entire families. Are going to be very vulnerable to COVID-19, so they do need the COVID-19 vaccination. So the global community does recognize that. So I just hope that, you know, national authorities will be facilitative, even if not willing to foot the bill for it.
I think on the rollouts, like in Philippines, I think yesterday or the other day, where the president offered the services of nurses in exchange for vaccines. So I think along the lines of how the vaccine rollouts are happening in other countries as well, I think everybody will have their own challenges. I think among Asian countries, we are probably doing quite well because we have received the vaccines and it's actually in our shores. But I think it's much too early to tell and compare between what we are doing with the rest of ASEAN. However, I would like to note that when comparing, it is always better to compare with those who have done better rather than compare with those who have done worse, because that puts us in a complacent state, thinking that we are doing well when actually we are not doing anything at all. Yeah, thank you.
Thanks. Wean, I think, and to a lesser extent, I guess, MK, here's a question. Has there been any effort to assess systematically long-term cost effectiveness of implementing public health enhancement for businesses? Or even Farhan, you're also a health economist. So.
He's the professor, yes. Go ahead, Farhan, if you want to attempt that question.
No, go ahead. You guys go first. I like to butt in at the end, you know, just to put in some spice into the answer, I guess.
I think it's an excellent question, because I think that's the kind of rigor that we do want when we're thinking about evidence-based measures. I think right now everyone's just focused on operations and just trying to get it running. So I think that's the priority right now. I think the other issue is if you are thinking of a evaluation of some sorts, then you have to think of what's the counterfactual, and it may be a little bit unethical to withhold or to delay measures for certain groups. So it'll be quite hard to really construct something which is like super robust in terms of its causal inference. But there we go. I think in terms of, like, if you want to think just in terms of cost effectiveness, well, what is the impact of COVID-19? The cost is so huge that that really almost any intervention is going to be cost effective, right? So if what you have done is you've had to grind your economy to a halt, right? You know, in order to deal with the COVID-19 pandemic, almost anything that's going to be offered to you is going to be cost effective. So if you think about it, like the COVID-19 vaccination, how much really should be a market price for it?
Correct.
If you did think about it, because even if it just slows down, even if it reopens your economy half a day early, 12 hours early, it probably is already cost effective.
I think I'm going to get shot down for this, Prof. Adiba. I think we're also at the end of the session as well. I think what needs to be said is they asked about the the cost effectiveness or the health economic impact. Honestly speaking, I think there are some people who are looking at it. The people who should be looking at it are probably not doing what they're supposed to be doing or looking at what they're supposed to be looking at. I'd rather ask this question. What health programs, public health programs, have they ever had this understanding of health, of cost effectiveness, or they've actually evaluated any of the programs that's being done? I'm talking about quit smoking clinics. I'm talking about, tak nak merokok. I'm talking about other public health measures such as dengue, Have they ever looked at any of the programs being implemented and its cost effectiveness? And I'll tell you the answer now, they have not. We have never seen anything being published. So I think they will never look at this anyways, because to me, what they're doing is that they just want to get this done. They want to vaccinate, and then they just want to move on. And I think the health economic impacts is something that we're probably going to see probably for up until the next generation. This is going to be something that is going to happen for decades to come. India has said that this is probably going to set them back 30 years in advancement. So I don't know whether Malaysia has actually looked at it. Every time we see, everybody says that we are on track to economic recovery. We're on track to economic recovery. That's not what's happening on the ground. The industries are telling me, nope, that's not happening. So I think, yes, we do need to look at it. I can think of Prof. Awang Bulgiba from your university as well, UM. He would be an excellent person that we can ask and see and discuss about this matter further. And this is something that is very important because we need to understand how much have we actually suffered.
So what if I paraphrase, sorry, Prof. Farhan, I couldn't help myself. It's basically what we'll have is an outbreak and a pandemic of PhDs in health economics and stuff. But I guess what really is what really the challenge will be is trying to deal with a whole mess of data, because I'm just realizing the kind of data collection that's going on now is really it's really quite poor quality. So it's like good luck to future researchers. To try it and sort it out. You might have to develop new methodologies.
From a practical point of view, MK, do you think all this is, I mean, you kind of answered it before, but perhaps from a cost effectiveness point of view?
Well, I think, that it's just scary. I think it just gives me nightmares sometimes even to think about the cost implication. It's what we're just all trying to do right now is just to get the operations running. I think there is just so much war that we are all facing right now across different angles. Just keeping the operations running is one. Making sure that people within the factory feel safe. I think that's the critical part right now, because it's just that whole psychological aspect that we have to deal with this current people right now that was coming in, and they're just constantly telling you, I think I'm sick and I want to test. That's something which we're dealing right now. So I don't think, I think, I totally agree with Dr. Yap just now. It's with what he has mentioned. I think, for me, I think I don't have as much experience, but definitely, the cost implication is something that we're still measuring.
Now, thank you very much for that. We are a little past 12, and I think it's time to wrap up. I'm going to be a bit more provocative at the end here, because there is a question that I'd like each of you to answer, and two questions. One is a question posed by one of our listeners, and the other is what change you hope to see when it comes to how we deal with migrant workers. So the question is there political will on behalf of the government to change the narrative from foreign workers being a security issue to them being part of a human rights issue? Just a quick yes or no from each of you. Farhan, you're on the top of my screen.
No.
Wei An.
I think the government is responding to people's a little bit of ground opinion. So I think the question is whether there's political will to try and be truthful and to be fair on what narrative you want to put out in the public sphere. Because I think that's going to determine the ground support and ultimately the political support for this.
Okay, Adrian?
So the ILO already did the study on public perceptions towards migrants, and it's really a nightmare. I'm very afraid of the future, and if it's almost like a chicken and egg thing in terms of public perception and policy. So more research, more engagement with the grassroots need to happen. So this can be bridged, and I really don't want to see this become into an academic exercise. As you said, it's a 20, 30-year-old issue. Yeah, we need data, and I think to a certain degree, there is certain data sets. But if it just becomes an academic exercise again and again, and an auditing exercise, ticking the box, this is good, then we're just not going to solve these issues here.
MK?
Unfortunately not, Prof. I think there's much more that we have to do in this area.
Okay, thank you. And on that note, how would you like to see things change?
I
What's
guess
the
I go
most
first again.
important thing? Yeah.
You know what? In this pandemic, and even if it's not a pandemic, you know what? We have to start looking at people as people. You know, we're all human beings here. There's no such thing as stigmatization that needs to be placed on anyone. And when we talk about health itself, we need to ensure that accessibility is for all. I always put this into the minds of my students and other people when I talk. Imagine if you were in their shoes in a foreign country and you were treated this way, how would you feel? How angry would you be at that government? And how angry would your people be at home for doing this? So I think how we should look at it is try to walk in their shoes for a moment and see where they have come from. And perhaps this will bring a perspective and touch a human side. And whenever making any key decisions, you should put aside sentiments, you should put aside politics, and you should put it based on science, and you should put it based on evidence. And only then can you progress. If not, I guess India may be 30 years back, we might be another 100 years away. So yeah, thanks.
Well said, Farhan. Well.
Wow. So I think this is like an ethical, moral kind of a question. There was a movie which is quite, well, highly rated, but probably you may not have heard of it. It's called The Painted Bird. And one part of this story involves a bird catcher. And the bird catcher caught a bird and decided just to paint it different colors and just released it and hoped that it would find back its flock. So what happened is this painted bird, which let's say just belonged to this flock, went back to its flock, and the flock didn't accept it, and they pecked it to death, and it died. So we have to realize that there is this very primal feeling of like wanting to be us versus them, which probably comes, I don't know where it comes from a very, very deep part of our human nature. But we have to also realize that a lot of the values and the faith traditions we have, and to be honest, even some of the glorious civilizations of the past and the current are based not really on trying to separate between the us and them, but trying to be open to all. And I think if we are able to just experience that and really reflect on our own selves as we have moved through life, as we may think we belong very closely to one particular group, but just something can change. You could just lose your leg and suddenly you have a new identity of being a disabled person. Will you be accepted? So you have to be really aware, really, that things like identity are things which are not really fixed to any of us, and these are things we can change. And if we see the others in us and we realize that our faith values really are not about having a I, us, them kind of a mentality, but really it is that those things are actually the things which are alien to our really stated, to our values and the things that we hold dear, at least that we explicitly say so in our declarations in faith, which is even mentioned in the country's founding documents. So I think if we really hold true to these, then we realize that these primal feelings are things that we do need to set aside to some extent, and realize that foreign workers and other people, firstly, they are not only are they a bit like us, but they're actually helping us to a large degree. They're looking after our kids, they're cleaning our toilets, they're doing things that we don't really want to do anyway. And if we just really start valuing that and seeing that, and we see how Malaysians are treated abroad, and we see how people who are from groups that we identify with are being exploited abroad, and even when they come to our shores, then I think we need to reflect on that. So ultimately, just 2 points. One is that there is that ethical, moral element to it, which we need to overcome our little primal kind of instincts. But there's also the economic glory part of it, which is really the societies which have been successful are those which have been open.
Also very, very well said, Wei An. MK, would you like to add to that?
Yeah, I think the change shouldn't be just coming from governmental regulations or that. I think it's all about society. I think society has to wake up. They have to understand. I think they have to value that we are all people. We're all humans, whether we are migrants or not. We are one community, and we all have to provide that support to everyone else. I think only through that we would be able to see and humanize migrant workers. We have to see them as humans. I think then that's when we would be able to value and treasure their contributions to the country.
Thank you. Also well said. And your last words, Adrian.
So when the Rohingya boats were arriving last year, me and one of my friends, he started like a petition page to welcome the boats instead of chasing them. And I think he only managed to get about 15,000 signatures. Can you imagine? There were 20 anti-Rohingya petition pages, which got about 350 signatures. So I think we really have a moral question that Malaysians need to ask. But here's the catch. The propaganda is by state missionary. There are Facebook pages that are public, friends of XYZ, who are churning out this propaganda. And we feel that this weaponization of migrants' identities is just to exploit them further. We see it happening in the different agencies. We see it happening in the corporate sector. I think there is a structural sin that we need to overcome. And in the globalized world where money, services, people are crossing borders in a more free manner, I think all the more we should celebrate diversity and show real solidarity with the migrants who are helping us in development. Thank you.
Thank you very much, Adrian. So that brings us to a close, and I don't think I can say it any better than all our four panelists have just shared with us what their thoughts on these issues are, except to say that obviously this has been, even before COVID, several decades long problem that we've not been able to deal with in a humane manner, and perhaps some of the reasons are because of what Adrian just said, that there's some structural sins. I've just learned that new phrase, and weaponization and of dehumanization of migrant workers for economic gains of some people in some sector of our communities. But I guess for real change to happen, we have to keep pushing and tap on our inner good self and hope that society, as you said, wake up. Because well, it's not just about human rights issues, but as I think Wei An said, we have to put, or Farhan said, you just have to put ourselves in their shoes, because I think there's there's a Christian saying that there for the grace of God go I, isn't it? That we may be living a a comfortable, healthy life at the moment, but things can change very quickly, and we may ourselves find ourselves in that position, God forbid. So on that note, thank you very much to all the panelists for not just helping us see through some of the challenges that COVID-19 has amplified in terms of these long-standing issues faced by our migrant workers, but also on some of the more philosophical, but very real need to examine ourselves as a society in order to be able to effectively deal with the problem in a evidence-based public health manner. The solutions are there, but the question is, will we? And we shouldn't just leave this to the politicians, because, as all of you have said, politicians react to what they think society wants. So it's up to all of us to help the politicians, or push the politicians to approach this in a much more humane, inclusive, and comprehensive manner. So thank you, all of you. And the next session that G25 and the Edunity Foundation is going to discuss will be another hot and contentious issue, which is the educational challenges during COVID times. As all of you with young children know, they've literally lost a year of education, and the impact on this, on our youth and our children, it has been and will continue to be huge. So in the same manner, I hope we'll be able to not just discuss the challenges, but also the solutions. And thank you to all the panelists for enlightening us with the solutions that are there. It's just a matter of are we ready to implement it? So thanks again, and have a lovely Friday and weekend to everyone. Bye-bye.
Thank you. All the best.
Thanks.